So coming to the posterior triangle of neck, the posterior triangle of neck, it is bounded by anteriorly by the posterior border of sternocleidomastoid. So here is the posterior. So this is the anterior border of sternocleidomastoid, and this is the posterior border of sternocleidomastoid. So the posterior triangle of neck, it is bounded anteriorly by the posterior border of sternocleidomastoid and posteriorly by the anterior border of trapezius. So this is the trapezius. So this is the anterior border of trapezius. So the posterior triangle of neck, it is bounded anteriorly by the posterior border of sternocleidomastoid and posteriorly by anterior border of trapezius. Okay, the apex of the triangle is formed by the superior nuchal lines. The superior nuchal lines where the two muscles gets inserted. So the apex of the triangle is formed by the superior nuchal line. We can see the superior nuchal lines on either side of the external occipital protuberance. And the base of the triangle, it is formed by the middle 1/3 of the clavicle. So the apex is formed by the superior nuchal lines where the two muscles meet, and the base of the triangle, it is formed by the middle 1/3 of the triangle. And coming to the roof of the triangle, it is covered by skin, superficial fascia. In the superficial fascia, we know that in the upper part we have platysma. It is a subcutaneous muscle which is supplied by the cervical branch of facial nerve, and also the investing layer of deep cervical fascia. They form the roof. So the roof of the triangle, it is formed by skin, superficial fascia, platysma in the upper part, and also the investing layer of deep cervical fascia. They form of the roof of the triangle. And coming to the floor of the triangle from above downwards, it is formed by semispinalis capitis, and the second muscle is, first is the vertical fibers are semispinalis capitals, and all the muscles, they go backward and downwards. All the except spinalis capital, the fibers are vertical. In the semispinalis capitals, the fibers are vertical, and remaining all the muscles which are forming the floor of the triangle, the fibers go backwards and downwards. Okay, so first muscle is the semispinalis capitis and second muscle is the splenius capitis, and third muscle is the levator scapulae. Levator scapulae, and fourth muscle is the scalenus anterior, and we have scalenus medius is here. And this is scalenus anterior, and this is scalenus posterior. So coming to the muscles that form the floor of the triangle from above downwards, they are formed by semispinalis capitis, splenius capitis, levator scapulae, scalenus posterior, scalenus medius, and scalenus anterior. Usually these muscles, they form the floor of the triangle. So only semispinalis capitals, only the muscle fibers are vertical, and the remaining muscle fibers, they are continuous backwards and downwards. So these muscles, they are covered by the prevertebral layer of deep cervical fascia. So that's about the boundaries of the posterior triangle. So the posterior triangle of the neck, it is bounded anteriorly by the posterior border of sternocleidomastoid, and this is trapezius, and posteriorly by the anterior border of trapezius. Apex is formed by the superior nuchal lines where the two muscles get meet. These two muscles get meet at the superior nuchal line. On the superior nuchal line, it is present on either side of the external occipital protuberance, and the base is formed by the middle 1/3 of the clavicle, and the roof, it is formed by skin, superficial fascia, platysma, and investing layer of deep cervical fascia. In the roof, we will able to see some supraclavicular nerves and also external jugular vein. Terminal part of external jugular vein we can also see in the roof. And coming to the floor it is formed from above downwards by semispinalis capitis, splenius capitis, levator scapulae, and scalenus anterior, scalenus posterior, and scalenus medius. Only the semispinalis capitis muscle fibers only they are vertically, and the remaining muscle fibers they are backwards and downwards. So that's about the boundaries of the posterior triangle of the neck. And this posterior triangle of the neck, it is divided by the inferior belly of omohyoid. So here the green color one, for representation I have this green color one is the inferior belly of omohyoid. It divides the posterior triangle into upper occipital triangle and lower supraclavicular triangle. So this is the upper occipital triangle, this is the inferior belly of omohyoid, which I have represented with green color. Inferior belly of omohyoid. Inferior belly of omohyoid, it arises from the suprascapular notch. From the scapula we have a suprascapular notch is there, and transverse scapular ligament is there covering the notch. So the inferior belly of omohyoid arises from the suprascapular notch, and this inferior belly of omohyoid, it divides the posterior triangle of the neck into upper occipital triangle and lower subclavian triangle. So coming to the upper occipital triangle. So the coming to the boundaries of the occipital triangle. Anteriorly by the similar posterior border of sternocleidomastoid, and posteriorly by the anterior border of this muscle, that is trapezius muscle, and floor it is formed by semispinalis capitis, splenius capitis, levator scapulae, scaleless posterior, and scaleless medius muscle. And coming to the base it is formed by the inferior belly of omohyoid. So these are the boundaries of the occipital triangle. So the inferior belly of omohyoid divides the posterior triangle of the neck into upper occipital and lower supraclavicular triangle. Coming to the upper occipital triangle boundaries anteriorly by the posterior border of sternocleidomastoid and posteriorly by the anterior border of trapezius, and the floor of the triangle is formed by from above downwards by semispinalis capitis, splenius capitis, levator scapulae, and also here semispinalis capitis, splenius capitis, levator scapulae, scaleless posterior, and also scaleless medius muscle also. Okay, so that's about the occipital triangle boundaries. And coming to the contents of the occipital triangle. So coming to the contents of the occipital triangle, first is the foremost important content is spinal accessory nerve. So this is the nerves I have represented with blue. So this is the spinal accessory nerve. Spinal accessory nerve is the 11th cranial nerve, and the spinal accessory nerve at the midpoint or at the posterior border of sternocleidomastoid, it goes downwards and backwards and disappears beneath the trapezius muscle. The spinal accessory nerve is the 11th cranial nerve. It appears along the posterior border of sternocleidomastoid. It goes downwards and backwards and disappears beneath the trapezius muscle. And this spinocleidomastoid is hooked by lesser occipital nerve. This spinal accessory nerve, it is hooked by lesser occipital nerve. So spinal accessory nerve is the foremost important content, and it is plastered by the investing layer of deep cervical fascia. This is the foremost important content of the occipital triangle. And coming to the other structures, this spinal accessory nerve, it divides the posterior triangle into upper carefree triangle and lower careful triangle. We know the important structures here. Here is the C3 cervical nerve, here is the C4 cervical nerve. The important structures of the occipital triangle, they lie below the spinal accessory nerve. Above the spinal accessory nerve, we don't have that much nerves are present. So this is the carefree triangle and this is the careful triangle. So when we observe the spinal accessory nerve, we should be very careful. That means below the spinal accessory nerve, we have more number of nerves out there. In order to remove any subcutaneous abscess, anything along the posterior border of sternocleidomastoid, we should be very careful, because spinal accessory nerve lies along the posterior border of the sternocleidomastoid. In order to take care, we should be very careful in order to take out subcutaneous abscess. So that about the spinal accessory nerve. So spinal accessory nerve, it present in the triangle along the posterior border of the sternocleidomastoid, and again it goes backwards and downwards and disappears beneath the trapezius muscle. It lies on the levator scapulae muscle. This spinal accessory nerve, it is hooked by the lesser occipital nerve. And this spinal accessory nerve, it divides the posterior triangle of neck into upper careful and upper carefree and lower careful triangles. Because upper carefree, no important structures are present above the spinal accessory nerve, and below we have so many nerves, vessels are present below the spinal accessory nerve. That's why it is careful triangle and this is carefree triangle. And if you want to remove any subcutaneous abscess along the posterior border of sternocleidomastoid, we should be very careful in order to avoid damage to the spinal accessory nerve. So that is the spinal accessory nerve is the true content of the posterior triangle of the neck. And coming to the other nerves, C3 and C4 cervical nerves. C3 and C4 cervical nerves, they supply the muscles over there. They supply trapezius muscle and also levator scapulae muscle. And spinal accessory nerve also, it supplies the sternocleidomastoid and also trapezius muscle. And beneath the spinal accessory nerve, we have C3 and C4 cervical nerves are present. C3 and C4 cervical nerves. They are like parallel. They lie parallel to the spinal accessory nerve and they are covered by the prevertebral layer of deep cervical fascia. So, apart from spinal accessory nerve, two nerves runs parallel to the spinal accessory nerve. They are nothing but third and fourth cervical nerves. They supply the muscles over there. They supply the levator scapulae and they supply the trapezius muscle. So that's about the other content, that is third and fourth cervical nerves. And coming to the other contents, dorsal scapular nerve. Dorsal scapular nerve, it arises from the C5 root of brachial plexus. Dorsal scapular nerve, it arises from the C5 root of brachial plexus. So this is the C5 root of brachial plexus. We know that the brachial plexus, it is formed by C5 to T1 ventral rami. So from the C5 root of brachial plexus, dorsal scapular nerve arises, and this dorsal scapular nerve, it disappears beneath the trapezius muscle in order to supply the rhomboides major and rhomboides minor muscles. So that is the third content. And coming to the other contents of the occipital triangle, we may see upper trunk of brachial plexus in the. Some upper trunk of brachial plexus also we can see in the occipital triangle. Upper trunk of brachial plexus can be also seen in the occipital triangle. We know that upper trunk of brachial plexus, it is formed by the C1, C5 and C6 ventral rami. C5 and C6 roots unite to form the upper trunk of brachial plexus. So upper trunk of brachial plexus may be occasionally seen, and other nerves that are seen in the occipital triangle are four cervical nerves. They can seen in the occipital triangle. So one is lesser occipital nerve, which hooks around the suprascapular nerve. Which hooks around the spinal accessory nerve. Other one is greater auricular nerve. We know that great auricular nerve supplies, it goes upwards and supplies the skin over the angle of the mandible. And transverse cervical nerve. Here is the transverse cervical nerve. Here is the transverse cervical nerve, and this is the supraclavicular nerve. So this is the supraclavicular nerve. Four cervical nerves, they are present. Four cervical nerves, these are the cutaneous nerve. They are present in the posterior triangle of the neck. One is lesser occipital nerve. Lesser occipital nerve, it supplies the scalp, which is ventral rami C2, and this is the greater auricular nerve. Great auricular nerve, it supplies the skin over the angle of the mandible, and also transverse cervical nerve and also supraclavicular nerve. So these are the four cutaneous nerves that are present in the occipital triangle. And coming to the other structures of the occipital triangle, we can see superficial cervical artery. Superficial cervical artery is a branch of first part of subclavian artery, and we know that subclavian artery divides into first, second and third parts. So superficial cervical artery is a branch of first part of subclavian artery, and also sometimes occipital artery can also be seen. Occipital artery, it appears around in the upper part of semispinal scapulus, and it passes around the occipital region to supply the back part of the scalp. That means they supplies the occipital region. So these are the contents of the occipital triangle. So coming to the contents of the occipital triangle, first is the spinal accessory nerve. So spinal accessory nerve, it appears at the midpoint of the posterior border of sternocleidomastoid, and it runs backwards and downwards and disappears beneath the trapezius muscle. So, and this spinal part of accessory nerve, it is hooked by, lesser occipital nerve. This spinal part of accessory nerve, it is hooked by lesser occipital nerve. And parallel to the spinal accessory nerve, other two nerves are there. They are C3, C4 cervical nerves. C3, C4 cervical nerves, they run parallel to the spinal accessory nerve, and they disappear beneath the trapezius muscle, and they supply the levator scapula and trapezius muscle, but they are invested by the prevertebral layer of deep cervical fascia. And coming to the other nerve, that is dorsoscapular nerve. Dorsoscapular nerve, it divides. Dorsoscapular nerve, it arises from the C5 root, and it supplies the rhomboids major and minor. And 4 cervical nerves also, they can be seen in the posterior triangle. They are lesser occipital nerve and great auricular nerve, transverse cervical nerve, and supraclavicular nerve. And this is the supraclavicular nerve. Supraclavicular nerve. And we can see the upper trunk of brachial plexus. We know that brachial plexus is formed by C5 to T1 roots, and C5 and C6 roots unite to form the upper trunk of brachial plexus. Sometimes upper trunk of brachial plexus may be occasionally seen in the posterior triangle. And coming to the occipital artery can also be seen. Occipital artery can also be seen in the upper part of the posterior triangle, and also the superficial cervical artery, which is a branch of subclavian artery, can also be seen in the occipital triangle. So coming to the contents, we have completed the contents of the occipital triangle. We learn about the spinal accessory nerve, and parallel to the spinal accessory nerve, we have C3 and C4 cervical nerves, and also we have dorsoscapular nerve from C5 root, and 4 cervical nerves, 4 cutaneous nerves. They are lesser occipital, great auricular, transverse cervical, and supraclavicular nerve. This is the supraclavicular nerve. So they are the 4 cutaneous nerves seen in the occipital triangle. And also you can see the superficial cervical artery, which is a branch of thyrocervical trunk, which is in turn is a branch of subclavian artery. These can be also seen in the posterior triangle of the neck. And upper trunk of brachial plexus. Upper trunk of brachial plexus occasionally seen in the occipital triangle of the neck. And coming to the supraclavicular triangle. Coming to the supraclavicular triangle, in front it is formed by the posterior border of sternocleidomastoid, behind by the anterior border of trapezius, above by the inferior belly of omohyoid. So this is the inferior belly of omohyoid. And based by the middle 1/3 of the clavicle. So coming to the contents of the supraclavicular triangle, we can see the subclavian artery here. We know that the subclavian artery on the right side, it arises from the brachiocephalic trunk. On the left side, it is directly from a branch of arch of aorta. So the subclavian artery, it is divided by the scalenus anterior muscle into anterior, posterior, into 3 parts. Subclavian artery, it is divided into 3 parts by the scalenus anterior muscle. So this is the subclavian artery. Here is the scalenus anterior muscle is present here. So subclavian artery, it divides the subclavian artery into 3 parts. This is the first part. The part which is behind the muscle is the second part, and the part which extends from the medial border of the muscle to the outer border of pars tip is the third part. So from the first part of subclavian artery, we have internal thoracic artery is there, dorsal vertebral artery is there, and costocervical trunk and thoracocervical trunk. From the second part of subclavian artery, we have costocervical trunk on the left side, and from the third part of subclavian artery, we have dorsoscapular artery. So subclavian artery, which is divided by the scalenus anterior muscle. So this is the scalenus anterior muscle. Okay, so the scalenus anterior muscle, it divides the subclavian artery into three parts. First part which extends from up to the muzzle, lateral border of muzzle, and the second part which is present behind the muzzle, and the third part which extends from the medial border of the muzzle to the outer border of first rib. From the first part, we have internal thoracic artery, vertebral artery, costocervical trunk, thoracocervical trunk, and the costocervical trunk on the left side, it arises from the second part of subclavian artery. And coming to the third part of subclavian artery, the third part of subclavian artery gives, on either side gives one important blood, that is dorsoscapular artery. And coming to the subclavian artery, third part of subclavian artery, we can see here in the supraclavicular triangle. So subclavian artery, it gives dorsoscapular artery. The third part of subclavian artery, it gives dorsal scapular artery. And also we can see subclavian vein here. So subclavian vein, it receives the tributary from the axillary vein and continues as a subclavian vein, which opens into the internal jugular vein, which in turn forms the brachiocephalic vein. So the subclavian vein, it is a continuation of the axillary vein, joins with the internal jugular vein and opens into the brachiocephalic vein. We can see the subclavian vein also here in the supraclavicular triangle. And terminal part of external jugular vein. So the terminal part of external jugular vein, can also be seen in the supraclavicular triangle. So the external jugular vein, here is the external jugular vein. The terminal part of external jugular vein, we can see here in the supraclavicular triangle. So these are the contents, and the most important content is the trunks of brachial plexus. The trunks of brachial plexus can be seen in the supraclavicular triangle of the posterior triangle. So coming to the trunks of brachial plexus, the trunks of brachial plexus, they are formed by the C5, C6, C7, C8, T1 roots. So sometimes the C4 also gives contribution to the formation of brachial plexus. We now call it as a prefixed type of brachial plexus. Sometimes T2 also involved in the formation of brachial plexus. We call it as postfixed type of brachial plexus. So C5, C6, C7, C8, T1 roots, they form the trunks of, they are the roots of brachial plexus. And C5 root and C6 root unite to form the upper trunk. So C5 root and C6 root unite to form the upper trunk, and C7 root continues as the middle trunk. So see here, C5, C6 roots unite to form the upper trunk. C7 continues as the middle trunk, and C8 and T1 roots unite to form the lower trunk. So, and from the C5 root, dorsoscapular nerve arises. And also a branch to the phrenic nerve also arises from the C5 root. So from the C5 root, dorsoscapular nerve arises, and a branch from the phrenic nerve arises, and from C6, C5, C6 and C7 root unite, it forms long thoracic nerve. So C5, C6 and C7 roots, they form the long thoracic nerve. So a small trick from C5 root, C6 root and C7 root unite to form long thoracic nerve. And coming to the upper trunk, from the upper trunk, two nerves arises. They are suprascapular nerve and nerve to subclavius. So this point is called Erb's point because totally 6 nerve arises from the Erb's point. So the C5 and C6 roots, suprascapular root, suprascapular nerve and nerve to subclavius, and anterior division and posterior division. And so C5 and C6 roots unite to form the upper trunk. Each trunk again divides into anterior division and posterior division. So I have marked it with red, anterior division and posterior division. This is the anterior division and This is the posterior division. The anterior division of the upper middle trunks, the anterior divisions of the upper and middle trunks unite to form the lateral cord of brachial plexus, and the anterior division of the lower trunk forms the medial cord of brachial plexus. And the posterior divisions of all the three trunks. So this is the posterior division, this posterior division, this posterior division, and this posterior division. All the three posterior divisions, they unite to form the posterior cord of brachial plexus. So see here, the C5 and C6 roots unite to form the upper trunk, and C7 root continues as the middle trunk, and C8 and T1 roots unite to form the lower trunk. Again, these upper trunk, middle trunk, and lower trunk again divides into anterior and posterior branches. Anterior and posterior, anterior division and posterior division, anterior division and posterior division, anterior division and posterior division. Here the anterior divisions of the upper trunk and middle trunk unite to form the lateral cord of brachial plexus, and the anterior division of lower trunk here unite to form the medial cord of brachial plexus, forms the medial cord of brachial plexus, and the posterior divisions of all the three trunks, this posterior division, this posterior division, and this posterior division, these three posterior divisions unite to form the posterior cord of brachial plexus. So from the lateral cord of brachial plexus, we have three nerves comes out from the lateral cord of brachial plexus: musculocutaneous nerve, lateral root of median nerve, lateral root of median nerve, and lateral pectoral nerve. So from the lateral cord, three branches arises. So here is the lateral cord, which is formed by the anterior division of upper trunk and middle trunk. Upper trunk and middle trunk, they are formed the lateral cord. So from the lateral cord of brachial plexus, three nerves arises, that is musculocutaneous nerve, and lateral root of median nerve, and lateral pectoral nerve. And coming to the medial cord of brachial plexus is formed by the anterior division of lower trunk. Anterior division of lower trunk forms the medial cord of brachial plexus. So from the medial cord of brachial plexus, from the medial cord of brachial plexus, which is formed by the anterior division of lower trunk, it gives five branches, that is medial pectoral nerve, ulnar nerve, medial root of median nerve, medial cutaneous nerve of arm, and medial cutaneous nerve of forearm. These are the five branches coming from the medial cord of brachial plexus. And coming to the posterior cord of brachial plexus, from the posterior cord of brachial plexus, you will able to see from the posterior cord of brachial plexus, you will able to see five branches, that is axillary nerve, radial nerve, upper subscapular nerve, lower subscapular nerve, and thoracodorsal nerve. These are the five branches from the posterior cord of brachial plexus. So the C5 and C6 roots unite to form the upper trunk, the C7 continues as the middle trunk, and C8 and T1 unite to form the lower trunk. From the C5 root, one nerve arises, that is dorsal scapular nerve. Dorsal scapular nerve supplies the rhomboid smudgel, and also from the C5 root, phrenic nerve arises. Phrenic nerve which supplies many structures in the body. Phrenic nerve is a important supply to the diaphragm. So phrenic nerve, and from the upper trunk, two nerves arises, that is suprascapular nerve and nerve to subclavius. Here 6 nerves meet, and this point we call it as Erb's point, because here 6 nerves meet. So C5 and C6 root, suprascapular nerve and nerve to subclavius 4 and anterior and posterior division. Totally 6 nerves meet. So C5 and C6 roots 2, suprascapular nerve, nerve to subclavius 4, anterior and posterior division. So totally 6 nerves meet here, and this point we call it as Erb's point. So suprascapular nerve, nerve to subclavius arises from the upper trunk. Again these trunks, upper trunk, middle trunk and lateral trunk, again divides into anterior division and posterior division. The anterior division of the upper and middle trunks unite to form the lateral cord. The anterior division of the lower trunk unite to form the medial cord, and the posterior divisions of all the 3 trunks, that is upper trunk, middle trunk and lower trunk, unite to form the posterior cord. So from the lateral cord 3 nerves arises. They are musculocutaneous nerve, medial pectoral nerve and lateral root of medial nerve. From the medial cord we can see 5 nerves: medial pectoral nerve, ulnar nerve, medial root of medial nerve, medial cutaneous nerve of arm and medial cutaneous nerve of forearm. And from the posterior cord we can see the axillary nerve and radial nerve and with upper subscapular nerve and lower subscapular nerve and also thoracodorsal nerve. So the trunks of brachial plexus, they are seen in the supraclavicular triangle. They are trunks of brachial plexus, they are seen in the supraclavicular triangle. Okay, and coming to the other than trunks of brachial plexus, we can also see some superficial cervical artery and thoracodorsal artery. We can also see superficial cervical and branches of the subclavian artery can also seen in the supraclavicular triangle. And also jugulo-digastric and jugulo-omohyoid group of lymph nodes, they are also seen in the supraclavicular triangle. And these are the contents of the supraclavicular triangle. So coming to the contents of the supratriangular triangle, we will able to see the subclavian artery, the third part of subclavian artery, and the scalenus anterior muscle divides the subclavian artery into three parts, and we can see the third part here in the supraclavicular triangle. Along with the subclavian artery we can see the subclavian vein, which is continuation of the axillary vein, and along with the interjugular vein it combines to form the brachiocephalic vein, and terminal part of external jugular vein also we can see here in the supraclavicular triangle, and trunks of brachial plexus, they are seen here in the supraclavicular triangle, and some parts of some arteries, some branches of third part of subclavian artery, that is dorsoscapular artery, can also seen, and also we can see we can see the branches from the costocervical trunk and thyrocervical trunk can also be seen in the supraclavicular triangle, and some lymph nodes, jugulo-digastric and some jugulo-omohyoid group of lymph nodes can also be seen in the supraclavicular triangle. So this is about the posterior triangle of the neck. So the posterior triangle by the inferior belly of omohyoid divides into occipital and supraclavicular triangle. So these are the contents, the nerves here, the contents of the supraclavicular triangle, and here are the contents occipital triangle, and here are the contents of the supraclavicular triangle. Out of this, brachial plexus is very important, and cervical plexus it is also found by C1, C2, C3, C4 cervical rami, and we can see the cervical nerves here, the lesser occipital nerve C2, great auricular nerve C2, C3, transverse cervical nerve C2, C3, and supraclavicular nerve C3 and C4. We can see all the 4 cutaneous nerve in the occipital triangle. So that's about the posterior triangle of the neck. So the posterior triangle of the neck, it is found with anterior border by the posterior border of sternocleidomastoid anteriorly and the posterior anterior border of trapezius posteriorly. Roof is found by skin superficial fascia, investing layer of deep cervical fascia, and we have in the superficial fascia we will able to see the platysma muscle, and floor it is formed by, from above downwards it is formed by semispinalis capitis, splenius capitis, semispinalis capitis, splenius capitis, levator scapulae, and scalenus medius and scalenus anterior muscle, and it is divided by the inferior belly of omohyoid into upper large occipital triangle and lower small supraclavicular triangle, and the contents of the, and these are the contents of the posterior triangle of neck.